Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring you information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I'm Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Michael Weber. Dr. Michael Weber is a medical practitioner for more than 30 years in Germany and leader of 3 medical centers for general and internal medicine, pain management, and cancer treatment. Besides his MD diploma, he is also a certified biochemist who's working in research with many national and international institutions and universities. He's president of the International Society for Medical Laser Applications, editor-in-chief of the International Journal for Medical Laser Applications, and co-editor of several other medical journals. He is also developer of the patented Weberneedle medical laser devices, which were financially supported by the German government and the European Union. Dr. Weber, it's such a tremendous honor to have you on the show today, and I'm so excited to hear what you have to say today. Dr. Weber, tell me a little bit about phototherapy. What brought you into that field out of all the different fields that are out there?
Yeah, that's a little bit a long story. You know, as you said already, I'm a medical doctor for more than 30 years working on patients. And, you know, when you're working long years on patients, at the end, during many years' experience, you recognize the limitation of our conventional medical therapy. So I have a strong education in medicine, and look at patients with chronic diseases, patients with chronic pain. Normally, at the end, we cannot do anything. We give them only medication. We give them painkillers and morphines, and you know all about the side effects. So after maybe 20 or 25 years, also I myself looked for a little bit else. What can we do else for patients? And I started to learn a lot of natural medicine. And about 1995, other treatment modalities like acupuncture became very famous in Germany. And also I tried with acupuncture. But many people, they don't like putting needles in their bodies. And fortunately, I came in contact with a famous professor of physics, of laser physics. And we had the idea around 2000 to replace the metal needles by so-called well-focused laser beam needles, what we only put on the skin and which goes into the tissue. And we had great success then in pain management using acupuncture. But it's not limited to acupuncture. You can put well-focused lasers on other pain areas. But the problem also is that a lot of colors, we have the spectral colors like red and green and blue and yellow, yes, will not even penetrate the body. So we developed also a system with which we can bring laser deep into the body. We use needles and special, very thin, sterile plastic fiber optics, which can lead the healing light of lasers everywhere into the body. That's the short story, and that's what we developed now in the last 15 years. We developed the devices, which are also 10 years certified by the FDA in the USA. So we have a big group already in your country who are using these kinds of methods.
So in addition to then using the light on specific acupuncture point or acupressure points, then you mentioned you can also bring that light into tissue, deeper into tissue with sterile needles and fiber optic. But you can also then treat the blood with that as well, correct?
Exactly. You see, there are many companies on the world using laser therapy devices, putting lasers on the skin, and they claim it will work in the depth of the tissue. And they all work normally only with infrared and red light, which can penetrate some centimeters into the body. But if you have maybe a bad knee osteoarthritis, you will not get the healing effect of light into the knee in contact with the cartilage or maybe deep on the spine or something. So there we have to put a needle in local anesthesia everywhere in the body where we want to use it and bring all the light in a very good concentration directly on the origin of pain. And what you said already, another option is, and what is really amazing, is to give the different kinds of light directly into the bloodstream, not from outside, but using a very tiny needle. We put it in the vein, and then we put the catheter, and then we can use all the spectral colors for stimulating of the different systems in the bloodstream.
And how does that work? I mean, you just shine light in the bloodstream, and the blood is passing through. I mean, you have the whole circulation. I mean, how frequently does the whole circulation pass through that needle? Is it every few minutes, couple of minutes, or?
Yeah, a couple of minutes, and we treat the blood about maybe 40 minutes or up to 1 hour using the different colors, mostly 20 minutes. And the question, of course, is how can this work? What is going on there in the blood? So first of all, maybe if you look in the history, irradiation or treatment, the blood with light has a long history, more than 100 years. The first treatment of blood, for example, with ultraviolet light, was done in the United States. There was a doctor, his name was Knott. He took blood out, irradiated the blood with ultraviolet light, put it back in the patient, and they could see great immunological effect, stimulation of the white blood cells. Ultraviolet light can kill bacteria and viruses. So this is spreading all over the world and done millions times in the last 100 years. But this procedure is a little bit complicated. You have to take the blood out, irradiate, put it in again. What is much more elegant is to treat the blood directly in the body. We call it in medicine in vivo. Yeah, so that means we have a very thin catheter and a small needle, and then we can put the light directly in the bloodstream in contact with the flowing blood cells. And the good thing is we cannot use only ultraviolet light, we can use all spectral colors what we have on the world in the sunlight. The blue, the green, the yellow, the red, and also the invisible infrared. And
they all have different functions, I assume. The ultraviolet, they has certain impact on the body, and then the green, the yellow, they have other types of impact on the body, right?
Let me tell some words how the different colors are working, because there's a lot of research done in the last 20 years. First of all, till 2000, 2002, only red and infrared lasers were available, and most of the old research was done with red laser. And red light, first of all, stimulates the white blood cells, and the white blood cells represent our immune system. And we have different types of white blood cells. We have the macrophage, our killer cells. We have different lymph cells, lymphatic cells, B lymphocytes, T lymphocytes. We have monocytes. There's a lot of different white blood cells, but this group of white blood cells represent our immune system. So the red laser mainly stimulates our immune system. But there's another effect also. There is an effect on which is like aspirin, There is lower viscosity of the blood, lower sticking of the erythrocytes and thrombocytes. So it has a great prevention effect maybe on heart attacks and stroke. So the viscosity of the blood is improved by red laser. So the blood flow is much better. The green light leads to a higher uptake of oxygen. There are different complex mechanisms on the membrane of the red blood cells, which leads of better oxygen uptake. And so the blood is flowing better, the microcirculation is better, and the oxygen uptake is better. The blue light is one of the most amazing lights, because blue light increases nitric oxide. which we produce during walking in our blood vessel walls. And everybody knows the nitro spray, what we give if we have a heart attack, for example. So nitric oxide is a radical which is bound in the blood by red blood cells. And once we irradiate this with blue light, it becomes free and opens up quickly the whole microcirculation. And nitric oxide has a lot of other effects for diabetes, for regeneration with stem cells. So there's so many effects with blue light. And yellow light is something very new, what we developed in the last years. Yellow light has a huge antidepressive effect. It brings melatonin up and serotonin up. People have a better sleep, better mood. It works against chronic fatigue. So that's in short a little bit, summary about the effects of the different colors of light.
And you're mentioning nitric oxide and its impact on the body. So, I know it does so many different things, and this is just from the blue light, where mentioned it has that anti-aging effect. And
exactly.
I read something.
If you look at anti-aging, it has huge effects. The problem is nitric oxide, what we produce in our body, is bound as a complex because it's a so-called radical to a hemoglobin, and once we irradiate it with, or it comes in contact with blue light, it becomes free and immediately makes its beneficial effect. For example, if we look a little bit deeper in medicine, everybody knows something about the so-called telomeres, and the telomeres are the end pieces of our genes, and some people have short telomeres and they die early, other people have long telomeres, and we know today that the blue light protects the telomeres by activating of a specific enzyme. We call it telomerase. This protects the breakdown of our telomeres on our genes, so it's the best anti-aging effect what we have in our body.
So in essence, by doing this intravenous blue light, obviously all these other ones, they have huge impact on the body as well. But if we just focus on blue light, you would live longer.
Yeah. I think, if we look a little bit deeper into the body, and we speak about anti-aging or maybe life expectancy, we have to look a little bit on our cellular structure, Everybody knows today that the energy is produced in our cells. There we burn the glucose and we use our oxygen to produce our life energy. And all cells, every cell in our body, they have specific small parts inside, we call them organelles, the so-called mitochondria. And the mitochondria are our energy factories where we produce the so-called ATP. That's our living substance which delivers our energy when we are running, when we are thinking, during sport and everything what we are doing. And the mitochondria, they are the key of our energy source and our life. And if we look a little bit deeper in this mitochondria, we find on the inner membrane of the mitochondria different protein complexes, and interestingly, all these complexes in the mitochondria, because everything develops in the sun spectrum, of course, every different protein complex works with different light for stimulation. So one complex is stimulated with blue, the next one with green-yellow, the next one with red infrared. So if we are able to bring the light right into the body, into the cells, into this mitochondria, we can stimulate the production of ATP. And then we increase our power and, everything. We have the best anti-aging effect. And also nitric oxide is produced in a certain amount in this mitochondria. And using blue light, it will dissociate from one of these complexes and leads to cellular regeneration. It's a very complex field, but I try to explain it a little bit that everybody can understand it.
Yeah, that's amazing. We're going to take a short break. You're listening to HealthMade Radio. I'm chatting with Dr. Michael Weber. We'll be right back. Welcome back to HealthMade Radio. This is Dr. Michael Karlfeldt. We're here with Dr. Michael Weber, one of the leading experts in regards to light therapy and its impact on the body. Dr. Weber, you were mentioning that light has an impact on the cell, on the mitochondria, which is where we produce energy, where we produce ATP, which is like our energy currency. And when that currency is decreasing and getting less and less, that cell has less of an ability to repair itself and also to fight off infections, to get rid of toxins and so forth. And with that, then many times what can happen is that it will then kick into using or burning sugar through a fermentation cycle rather than driving it through the mitochondria, where you use another kind of oxidation process to oxidize the sugar to produce energy. And many people point towards that is how cancer is being produced. So with then light therapy, intravenous light therapy, supporting the function of the mitochondria and making it more efficient and slowing down the aging, does this therapy have an impact on a dire of a situation as a person dealing with cancer?
Yeah, I think we can assume this because it's right what you are telling. We have different ways of our metabolic system, how we digest the sugar in our cells. We have normally the digestion in the mitochondria, with the production of ATP with oxygen. So in this way, we produce from one molecule sugar 38 molecules of ATP. But there's another way, and this is a bad way, the fermentation way, what you mentioned already. This one is without oxygen. It leads to hyperacidity also in the cell, and this delivers only 2 molecules of ATP. So this is a very bad way, and of course, if you speak about cancer, so it can be a way, to bring the cancer into the body. And of course, if the mitochondria are weaker, the energy source is weaker. And remember what I told you before, that we stimulate also with the light not only on the cell, but also we stimulate all the white blood cells and the immune system. I think we can regard this laser therapy, this intravenous laser, not only as an energy source. We can also regard it as a prevention for the body the body can fight better against infections, against virus infections. And of course, there might be also a preventive effect on the development of cancer. But if we speak about cancer a little bit later, maybe in this or the next session, we have to speak also how we can treat cancer with laser.
Oh, okay. So I know a lot of people are pointing towards cancer then that you have these different retroviruses that can impact on the genetic coding in a way that will then promote what's called oncogenes that will kind of drive the cancer process. So using then intravenous light therapy as a very effective tool then for the body to deal with these retroviruses that can then initiate the dysfunction of the cell that can drive it towards cancer. I would assume that would be a very powerful tool as well.
Yeah, if we speak about this field, you mentioned the retrovirus or maybe the human papilloma virus, this can cause cancer, we know this. We treat this in a little bit different way. First of all, we regard laser therapy as a therapy for regeneration. It has, and there are thousands of studies, laser light, especially the low-power laser light, not the high power for destruction of tissue, has a healing effect on the body. We can heal chronic wounds. We can treat degenerative diseases by bringing light in damaged knees or hip joints and shoulders, anywhere in the body or on the spine or so. There we use the regenerative effect of laser light. We spoke already about the preventive effect, maybe by increasing the immune system, so protect it a little bit for cancer. But if the body is already infected maybe by these viruses. Look on also chronic hepatitis. We know that chronic hepatitis B can lead to liver cancer later. Then we use not the regenerating effect of light, we can use also the laser light for killing cells. We want to heal and promote the good cells, but we want to kill the bad cells. How can we do this? We need specific light-sensitive substances, what we can give to the body and which we can stimulate light, and then we produce oxygen radicals, and then we can kill viruses, we can kill cancer cells. We call these substances photosensitizers. One of the most common one is derived from the chlorophyll. Chlorophyll, you know, from the green plants, is a so-called porphyrin derivative, similar like our HEM in our erythrocytes, can be stimulated by red light, produce oxygen radicals, can kill bacteria. It works against Lyme disease, for example. It can kill viruses, and also it can kill cancer cells. So we call this therapy photodynamic laser therapy.
So a patient would then use this or take this photosynthesizer orally then, and then receive a intravenous light therapy, like they would take chlorophyll, and that would then sensitize their body for the light, so that they can then kill off things like Lyme?
Yeah, in not so severe cases, maybe somebody has chronic Lyme disease or so. You can take some drugs orally. The chlorophyll, what we eat with the green plants, normally is not water soluble and cannot go into the bloodstream. There we use, which is already available in the U.S., so-called sodium copper chlorophyllene. It's a little bit changed, so it's water soluble. Also, nearly everybody knows the so-called curcumin. Curcuma, from the curcuma plant, or turmeric, we call it, is available everywhere and as a supplement in the supermarket everywhere. This is a wonderful substance which can be stimulated by blue light, and it has a long history that it can kill cancer cells. But if you stimulate this substance with blue light, you can have a great effect on cancer. So in case of chronic infections, normally we use these drugs orally. But in case of already a bad cancer in the body, maybe somebody has a lung cancer or anywhere else in the body, pancreatic, liver cancer, maybe with metastasis, we have to inject these photosensitizers into the bloodstream, and then we can stimulate the photosensitizer in the bloodstream with the right wavelength, with intravenous laser, first of all, to clean the blood from circulating cancer cells and so-called cancer stem cells. And later we can irradiate the affected organs by using laser light stimulation from outside, or if it's deeper in the body, we use the fiber optic systems, what we also use in the bloodstream.
That's amazing. We're going to take a quick break again. We'll be right back. This is Dr. Michael Karlfeldt. I'm here with Dr. Michael Weber. You're listening to HealthMade Radio. Welcome back to HealthMade Radio. You're listening to Dr. Michael Karlfeldt and Dr. Michael Weber. We're discussing light and its impact on the body, and how powerful it is in regeneration, anti-aging. But we kind of went off on the subject of cancer, and Dr. Weber, people sometimes have a little bit of a hard to understand that light can have an impact. I mean, we think of physical things, like we take this substance, we take this pharmaceutical drug, and we see that is going to have a physical impact. But light is actually a nutrient in itself that we need every day. But what's your thought on that?
Yeah, of course. Of course, everybody knows light is life. So without light, we wouldn't have any life on the world. Everything what is on the world is developed from everything what is living is developed from the sun spectrum. And interestingly, if you look at all the different kinds of living in plants and animals and the cellular structures, they're all developed in the light spectrum, and all different parts in our body, they also absorb a specific kind from the sun spectrum. And if we know this, we can really stimulate them, we can protect them. So that's the really anti-aging effect, or maybe it's it's in fact really what protects and promotes our cellular metabolism. If we speak about cancer, there's so much research about cancer done. We put billions and billions of money in cancer research everywhere in the world. But if we look what we could do 50 years ago and what we are doing today, there is not really a great change. And cancer is growing so quickly. In Germany, we had 200,000 new cancer patients 20 years ago. Last year, we had 400,000. And in the U.S., maybe several millions. So this is, although we are doing all this prevention investigation and everything, there's really no real progress. And if you look, chemotherapy, it's done everywhere. And I will not say chemotherapy is useless, no, but how many percent of patients can we cure, I say cure, with chemotherapy? We know it's less than 5%, but everybody's doing this, and everybody's looking for a new way. How can we treat cancer successfully without suppression the immune system and without any severe side effects? That's really the question. And if we speak about photodynamic therapy, what I explained a little bit before, we use a light-sensitive substance. We put the right light. It will bind specifically to a cancer cell, mostly by specific receptors and enhance so-called endocytosis. And we use the right light. We can easily kill the cancer cells without side effect. And this method is not. It is a traditional medicine because everywhere in the world it's done already. Photodynamic therapy is well accepted everywhere in the world. And we do it in skin cancer, keratoma, basal cell carcinoma. We put a light-sensitive cream on this, and we irradiate some hours later with lasers, and it disappears. This therapy is done in many U.S. hospitals, everywhere. It's approved even by the FDA. So there is no question if this therapy is working or not. But it's working only on the skin, because we have only the lasers which works on the skin. We cannot bring the laser deeper into the body. But using the fiber optic technology, you remember we can put light beam in the blood or everywhere else. We can bring all the wavelengths now deep in contact in the body to all cancers, and now we can treat them successfully without any side effect. That's the new way of so-called interstitial photodynamic therapy, and this opens up a huge new field.
That's incredible. So, and you've been able to isolate then these different what you call photosensitizers. You know, like you mentioned curcumin and then chlorophyll. Then also I know the from St. John's wort, the hypericin and
this is all this what you are speaking about is something what we use on the side as support. The problem is that all photosensitizers which are used everywhere in the world, they're all derived from the so-called porphyrin molecule, so what is in our hem or maybe in our chlorophyll. The problem is that all these photosensitizers only work with the red light. And red light is not penetrating very deeply. Red light cannot penetrate the liver, so all liver metastasis we cannot treat successfully. And we have developed a so-called nanoparticle indocyanine green. Indocyanine green is a substance which is on the U.S. market, FDA approved 50 years. Also in Germany, everywhere in the world. And it's used normally as an injection to show by the so-called fluorescence spectroscopy blood flow in arteries, in heart or liver. But it normally does not stay in the body and it goes in cancer cells. It's removed out of the body in 30 minutes. We have put this indocyanine green in some small so-called nanoparticles, so it will stay in the bloodstream, it will accumulate in a cancer, stays there for 5 days, and this one can be irradiated with infrared light, which goes a lot deeper in the body, goes through the liver, goes into the brain, through the bones. So today we have the access for all deep cancers in the body. That's the biggest development what we made in the last years, and this is our treatment, what we are doing every day on our patients.
And what are you seeing with this? I mean, what kind of results? I know sometimes you have a theory and you kind of move forward with that theory and you try it, but at the end of the day, what kind of impact are you seeing?
Yeah, we have a lot of cancer patients every week. We are doing this now for several years, and what I told you before, we had only the chlorophyll-derived photosensitizer. We had some good effects on small cancers, some superficial cancers, but all these difficult types of cancer in pancreas, in prostate, in kidney, in bones, sarcomas and everything, we were not able really to treat them successfully. But this new drug, which goes really in the bloodstream and stays in the body, in the so-called nanoparticles, we have a much better uptake. And also we use ultrasound-guided injections. So we have great success, for example, in breast cancer. Breast cancer, you can see quite well in ultrasound. You can give this substance in the bloodstream, and we inject it directly into and around the tumor. And through interstitial needles, then we give infrared light. And normally you can see after 1 week treatment reduction, mostly already 20 or 30%.
That's incredible. That's absolutely incredible. And yeah, it's just so important, I think, for people to recognize, something so harmless, without any kind of negative side effects like, chemotherapy, radiation, where you leave the host weaker after than before treatment. Here you can use something this powerful and have an impact on something like cancer, and they are stronger after.
However, I will not, what I said before, I will not say that chemotherapy is not working. Chemotherapy in a high dose has the side effect, what we all know. But I will not say chemo drugs are not working. But we also sometimes give chemo drugs additionally, but in a different modality. We give chemo drugs in a low dose, maybe 10, maximum 20%. They will not suppress the immune system. They will even enhance the immune system together with the photosensitizers. And we use chemo drugs as photosensitizers. So we know their absorption and stimulation wavelengths. We can measure them. And then we can stimulate the chemo drugs after infusion in the bloodstream with laser light. We use intravenous laser to stimulate, make the chemo drugs 10, 20, sometimes 100 times more effective without any side effect. We call this laser-stimulated low-dose chemotherapy.
That's incredible. So here's just kind of the beauty then of natural therapy, coming together with also more of the traditional and how they can work together.
Exactly.
Yeah.
We have to cancer is so difficult, this cancer, it is not one drug which kills all the cancer. All the cancers are different. They have different receptors on the cell, metabolism, everything, hormones and everything. But we have to put a nice protocol together for the different stages of cancer. And of course we use photodynamic therapy, we use intravenous laser. Maybe in very advanced cases with multiple metastasis, we give this laser-stimulated low-dose chemo. Then we have all these wonderful natural drugs like curcuma, chlorophyllene, vitamin B17. So there are different other things, and all this have to support. All those have to support at the end the immune system. If we destroy the immune system by high-dose chemo, maybe it helps, but how can the body regenerate? It is normally impossible. So we have put these different modalities together and then looking for the best protocols for each kind of cancer. That's our way of research, what we are doing.
Yeah, it makes perfect sense to me. We're going to take a quick break. We'll be right back. You're listening to HealthMade Radio. This is Dr. Michael Karlfeldt. I'm here with Dr. Michael Weber. Welcome back to HealthMade Radio. This is Dr. Michael Karlfeldt. I'm here with Dr. Michael Weber. We're discussing the impact of light. We've been chatting about how it can be very useful while dealing with something as dire as cancer. But then we also have been talking about its regenerative impact. And Dr. Weber, what can light do in order to be able to regenerate tissue and heal tissue and so forth?
Yeah, everybody speaks about stem cell treatment. Everybody has read something about stem cell treatment. We have our aging process. We spoke about mitochondria. We produce radicals in the mitochondria. They will be damaged. We call the mitochondria factories, of limited lifetime. That's our problem. We can, of course, try to save them a little bit longer using light, antioxidants and everything, and detoxification, everything what is done. But at the end, the mitochondria will die, the cell will die, and we will die. So the only way to keep organs maybe longer alive or to regenerate them are stem cells, yeah? And stem cells, I think you have read already a lot about this. Sometimes, it is working well, there are good reports, sometimes it's not working. We have to ask us why it's sometimes working, why it's not. First of all, stem cells, we have two sources. One source is bone marrow. Everybody knows this. And another source is the fatty tissue. Yeah, and we have 1,000 times more stem cells in our fatty tissue, so we have to get them out of the fatty tissue. We call them adipose-derived, so-called mesenchymal stem cells. That's what we are doing. First of all, you have to take some fat out, and you have to get the stem cells out of the fatty tissue. You can do this with so-called enzymes. We are doing this with a special ultrasound system. We can purify them, and they are ready for injection in joints or maybe even in the bloodstream. So the question is, how can we get them working? We want the stem cells, maybe they go to the liver or to the heart, what is damaged. And first of all, we have to target them. And the targeting we can do with ultrasound shockwave. No? So if the kidney is damaged, we give, after injection, some shockwaves on the kidney, there's more blood flow, and the stem cells will go there. So in the next step, we call this homing. In the next step, we want that they proliferate and that they're growing and that they're multiplying and that they're differentiating then in the new tissue, to make new liver tissue, new kidney or bone or anything, or cartilage. So now we come back to laser therapy. We know that laser therapy stimulates the mitochondria, and stem cells have thousands of mitochondria. They need a lot of energy to run this process for differentiation, so we have to stimulate them with laser therapy. So we are doing this after intravenous infusion by blood irradiation with all spectral colors. Or when we inject them in joints through a needle, we put a catheter in the needle and irradiate the joint inside with all spectral colors. And this works amazing well. And another option is bone marrow. We have a very new technology. We are not taking the bone marrow out. We put a needle in the bone marrow, in the iliac crest. We put a catheter inside, same like the bloodstream, and we stimulate the bone marrow cells inside the bone marrow, and they will be activated and go in the bloodstream. So that's, in short word, the way how we stimulate, because it's laser-stimulated stem cell therapy, and we have amazing results with this.
That's incredible. So just stimulating, putting a catheter into the bone marrow, you'll actually activate those stem cells or stem cell production, and they start to spill out, and it will increase in tissue regeneration.
Exactly. So mostly we combine a small immunoliposuction. We take out about 50 cc of fat, is done in 20 minutes, and then we gain about 100 or 200 million stem cells. And this is a so-called stroma vascular fraction of the fatty tissue. There are also some so-called progenitor cells, pericytes, a lot of cytokines, which are anti-inflammatory. There are a lot of growth factors inside. So this is the mixture, what is coming out from the fat and what we can inject in joints, on the spine, or in the bloodstream. And the bone marrow, we stimulate directly inside, so we combine both methods. But the main thing is that the patient get laser therapy. And, when the patient goes home, how can they further stimulate their stem cells? For this way, we have developed a so-called laser watch with 12 lasers on the back, which the patient can carry every day for 2 hours on his wrist joint, and the energy of the lasers goes into our wrist arteries. That's something what the patient can do after this.
That's incredible. And obviously stem cells, for listeners that are not aware, stem cells are cells that can become pretty much any kind of tissue. So if you're dealing with, for instance, a degenerative liver or kidney, your kidney function is going down, and you need to regenerate the kidney or heart or whatever organ may be. Stem cells can do that, but then using the light, as you're mentioning, to really activate the stem cells after you receive the stem cell treatment or stem cell therapy.
The light is the key. The same thing what we spoke about, mitochondria and blood irradiation, the light is the key. We have wonderful studies, especially done in America from Boston, Harvard University, about light-stimulated stem cells. The light is the key. The light is our life, and the light is the one what we need for making the stem cells really effective.
Yeah, that's incredible. And so what kind of, I mean, with this type of therapy, I mean, what have you seen? Have you seen the impact of people where tissue's been regenerated?
Yeah. I give an example. We had a very, very happy day today. And I had a lot of doctors here today from U.S., from Germany, from Switzerland, and different countries. I had a patient from England. He was here 3 months ago. He had shrinking kidneys, from hypertension, kidney function nearly zero, creatinine was 6. They looked for already for transplant kidney, and he was in a bad situation. And in the ultrasound, I could see only some shrinking tissue, 6 centimeters. You could not really differentiate a figure, of the kidney. So we did all this treatment, and he came back with his doctor from Frankfurt today, and he came with a creatinine of 4, was 30% better. But the main thing is I made an ultrasound, and especially the right kidney. In the left one, he had a big stone, so I think that we cannot do many things. But the right kidney had nearly normal size. I checked with the color Doppler, the blood flow in the kidney, really completely regenerated. Unbelievable. So we had a wonderful day today.
That's incredible.
And other patients, especially with neurodegenerative diseases, we have great success on patients with Parkinson, stroke patients. Right, some weeks ago, I had a patient with a Huntington disease. This is a degenerative effect on different brain issues, parts, and with great effect, patient can walk again and speak again. I think we just opened up this field, and I think the main thing is maybe a little bit for fun. I have a mother. She is my best one. She is 96. She will become 97 very soon, and still active. But now is a point where it's going down. Her visus is going down. I gave her stem cells now 2 times, and the last time about 3 months ago. You should look at her. She looks like 60. I think I can give her another 20 years. So I think maybe, but animal experience showing this already, we can maybe extend life expectation with this kind of therapy. That will be the future.
That's incredible. Yeah, it just seems like we're just taking medicine to a new level. We're taking a leap. I so appreciate you coming onto the show today, Dr. Weber. We have to end, which is always the hard part for me. I'm Dr. Michael Karlfeldt with HealthMade Radio. Remember to connect with us at healthmade.co. Thank you so much, Dr. Weber.
It was a great pleasure for me. Thank you also very much.
Thank you.